Hello, good evening. Dr. Trudy Ufondo of Snowspirations Global Health Solutions. Thank you and welcome to our Tuesday Open Clinic with Dr. Trudy. This evening, we're going to talk about primary infertility in both males and females. How can we succeed in achieving pregnancy in a man that has primary infertility, in a woman that has primary infertility? And I'm going to start. What's infertility to start with? Infertility is globally defined as the inability to achieve successful pregnancy after a period of 12 months of unprotected sexual intercourse. Regular, unprotected sexual intercourse. So there are key things you have to be on the lookout for. 12 months. Regular, unprotected sexual intercourse. Not random, not passive. Regular, active, intentional, unprotected sexual intercourse. So unprotected means you are not on any contraceptive. You are not intentionally avoiding pregnancy. You are intentionally cohabiting, making love, but after 12 months, you are not able to achieve pregnancy. This is the global definition of infertility. Now, infertility can also be modified based on your age. So the global definition of infertility is applicable to everyone, but once you get to age 35, the definition also became modified. So when you are at 35, if you and your partner have been diligently and consistently making love every other day, 48 hourly, then after 6 months, if you don't have a positive pregnancy test, then you are classified as what? Having infertility. So you can see the difference. 12 months for everybody, 6 months for women, 35 years and above. For men, we don't have that age differentials. Men is just generally across the board. But for women, age 35 is the game changer for the simpler fact of changes that happen in the body of a woman when she gets to age 35. So if we understand the definition of infertility, then we can begin to look at different types. So infertility is broadly divided into primary infertility and secondary infertility. Now, the one we want to tackle today is actually the most difficult. So in primary infertility, since you became sexually active, that means since you started making love without protection with your partner and intentionally, you have never been pregnant in your life. So for the woman, primary infertility is a situation where for the past 10 years, she's been making love without protection. She has not tested positive for pregnancy. For the man, since you became sexually active, you have not impregnated any woman. And up to this moment, you are still having problems. That's called primary infertility. The opposite is secondary infertility. In the past, you got pregnant. You had your baby, you had miscarriage, you had stillbirth, but currently you're finding it difficult. The same thing is applicable to the man. 10 years ago, you fathered 12 kids. 2020, during COVID, you stayed back home, you had 20 kids. You went to your community, you fathered you impregnated all the ladies in the community because you had, the wherewithal. But in 2022, you have not been able to get your woman pregnant. Or maybe when you were doing relationship before you got married or before you settled, you got your girlfriend pregnant in secondary school, in university, but currently you are not able to get your woman pregnant. That's called secondary infertility. So between the two, primary infertility is tough to handle because you haven't been there before. The secondary infertility, you were there, but for some reason, something happened. So when we compare and contrast primary with secondary infertility needs a lot of detailing. So how can we achieve pregnancy in a woman who has primary infertility? How can we achieve pregnancy in a man who has primary infertility? In 2022, our overall aim is to make sure that every desiring woman, every desiring man in our community is Snowspirations Global Health Solutions. It's a global community. Every desiring mom, every desiring father will become using our method. Our method is PPP. The first one is pray. We pray a lot. The second one is play. We play a lot. The playing component refers to love making every 48 hours. If you are in our community and you are sick and tired of being sick and tired of not having your own baby, then you must embrace the second P. Very important. You have to make love every 48 hours, regardless of whatever factors are there. Then the last P is part of what we're talking about today, practicing every single thing you've learned. Ovulation, fertility window, body this, body that, weight loss, eating healthy, sleeping. Every factor that can affect the totality of you, you begin to practice. Now, what are the steps we can take to get a woman pregnant if she has primary infertility? Number one, history. Your history is very important. When I'm getting your history, I want to know how old you were when you started having your bleeding. I want to know the regularity of your bleeding. I want to know if you've had any problems in the past. Do you have any surgery? Do you have any chronic medical condition? I want to know your body weight. I want to know your height. I want to calculate your BMI. Then I want to know the frequency of your lovemaking. Then I want to know your sexual experience. Have you been exposed to sexually transmitted infections in the past? Have you had abortions in the past? You see, there are certain things you might think might not be related to what we're talking about. On the overall picture, they are related. Do you know why? Because you didn't happen by accident. Your mother gave birth to you. So by default, you should also give birth to your own baby. So primary infertility, from the female perspective, we start with history. History is the biggest weapon in dealing with primary infertility. Then we begin our physical examination. Physical examination of a woman means we have to start from the head to the toe to dissect and check the totality of her. We have to check your full development of female secondary characteristic. So when a woman becomes a woman, it's expected she will develop breast. So we have to make sure that your breast is fully developed. We have to make sure that your female reproductive system is fully developed. We have to make sure that you are at least ovulating. Then we need to look at your whole comprehensive reproductive system. So besides making sure we get enough history, we have to also go into detailed physical examination of this female reproductive system. Give me a break, guys. So part of what we're going to do to help this woman, we have to start from the vagina. Make sure the vagina is very healthy. Make sure the environment of the vagina is user-friendly. Then we step up to the cervix. We make sure the cervix is not stenosed. Some women might have stenosed cervix. So what's stenosed cervix? The cervix is gummed together. It's called cervical stenosis. If you have this, we need to open it up. Then we begin to enter the womb. We have to take a comprehensive look at the womb. Some women might have structural congenital problems. Some women might have poorly developed womb. Some women might have double womb or unicornate womb. So any womb abnormalities, unfortunately, if we discover any womb abnormalities, there is nothing we can do about it because it's something that happened to you before you came into this world. So congenital problems, unfortunately, if we're able to have the eggs, then we can survey the eggs and we can go for assisted reproductive technique. Then we begin to go up. We get to the tubes. We make sure the tubes are patent. So what do? We run HSG, hysterosalpingography. We make sure that the tubes are open. Then we go to the ovaries. We take a good look at the ovaries. For you to become pregnant as a woman, you need at least one functional ovary. What will get you pregnant as a woman naturally is what? One tube, one ovary. You don't need both of them. The reason why God gave you both of them is to compensate. So if anything happens to the left, the right will compensate. If anything happens to the right, the left will compensate. So what you need as a woman to become a mother, to become pregnant, it's one ovary, one tube, one womb, one cervix, one vagina. The other side is complementary. So these are the basics we have to observe. Now, when we are done doing this, then we begin to have comprehensive reproductive hormone assay. So there are some hormones that helps a woman to become a woman. So we take a look at your estrogen, progesterone, FSH, LH, prolactin, and thyroid hormones. We check their levels. Now, by the time we are doing this, it's expected that by the time I'm running my report, I would have discovered where the problem is coming from. So if you discover that the vagina is not user-friendly because of the environment, the vagina is ordinarily supposed to be user-friendly so that when the penis comes in, when the sperm is deposited, the sperm will not die. Unfortunately, some women can have some antibodies we call anti-sperm antibodies. So your body produces some antibodies that will attack the sperm. So we check comprehensively to make sure the vagina is good, to make sure the cervix is good, to make sure the womb is good, to make sure the tubes are okay, and the ovaries. Once we are satisfied, then we begin to go to your lifestyle. We check your body weight, we check your height, we calculate your BMI, we make sure that your body weight is within normal range. Then we ask you about your social history. Are you smoking? Are you drinking alcohol? Then we ask you about your sexual history. How often do you actually engage in sexual practices? Orientation matters. It will baffle you that some women do not know how to make love. It will baffle you that some couples are putting the penis inside the anus. I'm not joking. Orientation matters. So we begin to educate you on the need for frequency, regularity, and the real essence of lovemaking. Very, very important. Now, when we are done doing this, it's expected that at some point we'll discover where the problem is coming from. Once we discover the problem, we have solved that problem by 50%. So in course of doing all this, assuming we discover that you have problems in your cervix, we'll try and address it. Some women, unfortunately, might have some adhesions. So adhesions are like cobwebs. They are like scar tissues that cover the endometrium, which is the place that your baby should be developing. If we discover that, then you have to go for minor surgery to remove that. Some women might have polyps. Some women might have fibroids. Some women might have thick endometrium. Some women might have thin endometrium. Some women might have congenital problems. Some women might have a septum. Once we discover the problem, we begin to solve it immediately. Some women, for some reasons, I'm telling you what I know, some women might actually have bilateral tubal blockage. Some women might have started sex very late. Some women might not have viable ovaries. Some women might be having what we call an ovulatory cycle. So you're bleeding, but you're not ovulating. So depending on what we discover, that's the basis for our management. Now, if we check your body weight and we discover that your BMI is above 30, then we begin to use lifestyle modification to see how we can bring you up to speed. When we are done doing this, it's expected that at any point in time, we discover a problem, we begin to solve them. So if we discover that the woman is having ovulatory problems, that means she's not ovulating. But we know for sure that the woman still has eggs. What are we going to do? We are going to give her ovulation induction drugs, which is the category where you have your Clomid. Now, there are some times we'll check everything in the woman. She's perfect. There are some women that are perfect. They are ovulating. Everything is okay, but they are not becoming pregnant. And when we check their partner, they are 100% okay. The sperm is okay. The motility is okay. The morphology is okay. The count is okay. But he's not getting the woman pregnant. There are some couples in that category. They are called infertility of unknown origin or unexplained infertility. When you have that, then we need to graduate. So the key to solving the problem of primary infertility is SCARP. Knowledge, attitude, practice, and perception. So if you have never been pregnant in your life as a woman, this is not the time to spiritualize things. This is not the time to throw a pity party. You need a fertility specialist. Let's assume you are 35 and in your 35 years, you have been making love, but you have not tested positive. Something is fundamentally wrong we need to fix. You can't do this by wishful thinking. You speak it forth. You go and seek help. You get a fertility specialist. You get someone that knows. Sometimes you need to even diversify, refer you to endocrinologists, refer you to other subspecialties in medical practice to see if we can discover the problem. Once we have discovered problems in infertility, the solution is 50%. So if we discover that you have cervical stenosis, and that has been the problem, then what are we going to do? We make sure we create an opening so that the sperm can come in. If we discover you have problems with the endometrium, we try as much as possible to combine a couple of hormones to make sure your endometrium is good enough. If we discover that your eggs is the problem, then we try as much as possible to see what we can do. So the management of primary infertility is solely dependent on appropriate diagnosis. Once we get that diagnosis, we have solved the problem. Now, there are so many women that had primary infertility that got so good that over time they broke the backbone of primary infertility and they completed their family. So there are some women that will not have their babies until they get to 40. And before they get to 50, they would have completed their family. They can have 2, they can have 3, they can have 4. So you might have been trying since your 20s. And suddenly you sought help, then suddenly you started having your babies at 40. By the time you're 50, you've completed your 4 babies. It's possible. You can actually have 1 pregnancy and you have 4 babies. You can actually have 2 pregnancies and you have your 4 babies. Why? Because as you're getting to that stage, the possibility of having multiple pregnancies is very high. So the advantage of starting your family late, based on whatever problems you were having, is the fact that God is so good. Once your family starts, you can easily complete your family, especially in this era of modern technology. So gone are the days when you will think, oh, this is how the life is gonna. Every singular woman that wants to be a mother can be a mother in this group. Now, when we talk about the men, because I noticed I also included men in the equation. Now, the same thing is applicable to men. When we are talking about primary infertility in the man, we have to investigate the male reproductive system. Number 1, we have to take a lot of history. There are some men, when you see them, the way they look, the way their body is shaped, the way everything is all about them, you can see infertility there. Most times, the problem that men will have regarding starting their family is based on lifestyle. You've been drinking the whole beer in the community, you've been smoking, you're not exercising, your body weight is going off the hook, you're not sleeping, you're pursuing money all over the place. They can alter your normal hormone production and you will not be able to get a woman pregnant. And unfortunately, you might even develop erectile dysfunction. And when you develop erectile dysfunction, you might end up in the bar and you begin to drink the alcohol you're not supposed to drink and you begin to eat all the things you're not supposed to eat. So in investigating primary infertility in men, we have to take a holistic approach. So besides looking at the male reproductive system, so this is the penis, we take a comprehensive look at the penis. We importantly examine the scrotum. This is the powerhouse in a man. You see these 2 balls? This is where the magic begins. So we have to physically palpate. So palpating means you have to touch and make sure that the man has 2 testicles. Now, the testicles develop from the abdomen. You don't just give birth to a baby and the testicles will be here. They start developing from the abdomen. Then as the baby is developing, it will start descending. In some men, for some reason, these 2 testicles is arrested somewhere on their descent. So we have to make sure that the man at least has testicles. So today, as a man, if you don't have a baby, if you've never impregnated a woman, please take a moment and check your 2 balls yourself. Be very user-friendly to examining your own reproductive organs. If you know the normal, you can begin to worry when there's an abnormality. Some men can have shrunken testicles, or some men can have swollen testicles. You have to know your normal so that you begin to talk about the abnormal. If you pay attention to your balls as a man, when you stand, openly and you look yourself up in the mirror, one of the testicles tends to be, taller than the other one. The position is more like this. That's okay. The reason why your testicle is hanging outside your body is because they enjoy cooler environment so they can produce sperm through the process of spermatogenesis. So we need to take a critical look. Then we go up, then we begin to ask you a lot of questions. Have you had surgeries in the past? Have you had hernia surgeries? Have you had, any injuries when you were growing up? Were you rough? What did you do? Did you smoke? Whatever you did, we have to have comprehensive history from the man. Then we begin to also check your hormones. We check your testosterone. We check your estrogen. We check all the important hormones in your body. Then we begin to check your weight. We begin to check your height. Then we begin to look at your lifestyle. By the time we are done doing this, it's expected that somewhere along the line we would have discovered where the problem is coming from. So in a summary, the key to defeating primary infertility is knowing where the problem started. Now, some people might not be able to naturally become pregnant. So what are we gonna do? We are gonna place some women on fertility drugs. When the fertility drug fails, we're gonna graduate. We're gonna go for IUI. When we are going for IUI, we will allow your body to give us the eggs. When that one fails, we give you some ovulation induction drugs and see if we can get eggs. So the management of primary infertility is a stepwise process. Now, when everything we've done fails, we now graduate to what? IVF. So there are so many women in my community. There are so many men in my community. You're having primary infertility, but your primary infertility will end in 2022. How can it end? Because you're practicing our PPP. You are praying, you are playing, and you're practicing. And this is the year that your infertility will end. Thank you so much. I'm going to open the clinic now to take care of your questions. So please, if you have any questions, feel free and ask your questions in real time. Remember, we just finished talking about primary infertility, stepwise process of defeating primary infertility and becoming pregnant. The clinic is open. If today is the first time of attending my clinic, thank you so much. I appreciate you. Remember to subscribe. Now we have an exclusive community where you can subscribe and I can meet you halfway one-on-one. So you can click on that, join the community, and you decide what you want to do, then I'll meet you halfway. Now, there are so many other videos in the channel that can help you to become. On the 29th of this month, we actually have a special event for women above 35, which will classify as advanced in maternal age. Make sure you register for that event. But right now, I'm ready to take care of your questions. If you have any questions, please ask your questions so I can give you a feedback. Ask your questions so I can give you a feedback. Okay? Any questions? So even if it's not related to this topic, still ask. I have about 8 more minutes to go. So ask your questions and I'll give you a feedback. Okay? All right. Can a man with erectile dysfunction get a woman pregnant? Yes. Remember, erectile dysfunction is a separate entity. Okay? So a man with erectile dysfunction is having problems with the penis being active to engage in the process of lovemaking, right? Like a sleeping penis cannot make love. For a penis to make love, it has to be turgid. It has to be erect. Some men might not have those ability to achieve erection. Now, erectile dysfunction doesn't mean you don't have sperm. So there are some men that might not be able to achieve erection, but their sperm is doing good. So what we're interested in is the sperm. So the fact you have erectile dysfunction might be independent of your spermatogenesis. So long as you're producing sperm, we're good to go. There are some men that might have some problems that will warrant us to go back into the man's scrotum and tap the sperm. But you need help. If you have erectile dysfunction, you have to see a urologist so we can begin to treat you appropriately, because here's the deal, whether you like it or not, the role of a man is to play the role of a man. So in course of your lovemaking is not just to make babies, it's also to, it's for fun. So if you can't play that your civic duty as a man, something in you will die. Your confidence, your pride, your whole manliness can go in a twinkle of an eye, and it can deep into depression. There are some men that have had severe mental health problems because they have this anxiety, performance anxiety. They've had this problem. There's a particular client I have, since he became a man, he hasn't been able to achieve erection. So if you have this problem, you open up, you seek help, then you modify your life. There are so many things we do that is actually leading to all these problems. Okay, so erectile dysfunction doesn't mean you can't get your woman pregnant. You still can't get your woman pregnant even when you have erectile dysfunction. How do you register for the class? Well, what do you call it? YouTube is not allowing us to post the links, but it's in our Facebook. So if you're in our group in Facebook, you quickly go in there and click and register. We have few slots. Okay, all right. How does HIV affect infertility? Now, directly, HIV will not stop you from becoming pregnant. Okay? You just happen to have HIV. Just like any viral infection, just like any bacterial infection. If you have a very good controlled infection, if you take your HIV medications, and if you control the viral load, you can live a normal life. You can even be HIV positive and your partner will be HIV negative. And you guys can even have a baby that will be HIV negative. So HIV does not have anything to do with your infertility. Infertility is a completely isolated case. Your HIV happens to be an infection. So what do you need to do if you have HIV infection and you want to be a mother? You make sure you are under the care of infectious disease specialist. So we manage your HIV. Remember the difference between HIV and AIDS. HIV simply means human immunodeficiency virus. You have the virus. AIDS means acquired immune deficiency syndrome. So when you get to AIDS, that's the place you don't want you to get. So you can comfortably have your HIV right now and you can live up to your 90s. Complete everything you want to do in life and you'll be fine so long as you're taking your medication. But when you don't do the right things, you are going to graduate to AIDS. AIDS is where the problem is. AIDS is the terminal one that will kill you. So gone are the days when we mention HIV, people begin to freak out. There are so many people that are HIV positive, doing their thing in the society, doing their business, not worried. Okay? All right. Can a woman with HIV have multiple pregnancy? Why not? There is no difference between a woman that has HIV and having all the potentials. So long as your eggs are good, so long as you have good potentials, you can have your multiple pregnancy. Completely okay. 100%. But this is what you need to do. You have to declare that this is what you have so we can manage you appropriately. That HIV is a risk factor. So we have to make sure we manage you, manage your partner, manage your baby so that you guys will all be good, the three of you, okay? But you can have your twins, you can have anything, you can practically do anything you want to do as an HIV person. 100%. All right? Okay. Key to solving secondary infertility. So remember, secondary infertility is the opposite of primary infertility. Secondary infertility is actually a little bit easier to manage because if you were pregnant in the past, the possibility you can become pregnant again is very high. So secondary infertility management is also dependent on the cause. So if your tubes are blocked, then we need to look at things differently. If you're not producing your eggs, but you have the eggs there, we need to give you some ovulation induction drugs. So it depends on what the problem is. But secondary infertility is also a case you can defeat and you can have your baby. Okay? What's the cause of no evacuation? What do you mean by that, mother? What's the cause of no evacuation? It's not a straightforward question. So let me explain. Evacuation comes into the bigger picture when you recently have miscarriage or stillbirth. Normally, when you have miscarriage, it's expected that your body will expel all the components of your baby from your body. That's the normal expectation. That same baby that makes you happy, that same baby you want to have, once the baby is dead inside your body, we want to bring the baby out completely. We don't want any part of your baby inside of you. Now, some women can expel the contents of their baby completely by themselves. Some women, we might give them some drugs. Now, some women, even waiting for them to expel it or giving them some drugs, they will still have what we call retained product of conception. That's when we'll now begin to go for evacuation. So evacuation means we have to go in and evacuate. That means remove all the nyama-nyama, remove all the baby parts from your body completely. We have to remove it completely. So the question you're asking me, it's not too clear. Any woman that has had that unfortunate, sad episode of abortion or stillbirth must go through normal checks. We have to run an ultrasound. We have to make sure that your womb is empty. If need be for you to go for evacuation, then you need to go for evacuation. Very important. Some women will not do this. They will have retained product of conception and they will quickly want to become pregnant again. Then that part of your baby inside your body will begin to cause problems. Okay? Hi, doc. You have fibroid taken out 3 months after your last period, since 10 years after doctor says it's premature menopause. Could you Menopause be at 32. Unfortunately, some women can go into menopause before 40. So if you have not seen your period for the past 12 months and you're having all the classical signs that you might have menopause, dryness, hot flushes, low libido, mood swings, and you have not bled, you have not had your period for past 12 months, my sister, you've gone into primary ovarian failure or primary ovarian insufficiency. So any woman that has gone into menopause before age 40 is considered premature menopause. Unfortunately, it can happen at any age. So at 32, it can happen. Now, you mentioned something about 10 years. Does it mean you started wanting to become pregnant for the past 10 years? That means you were 22, because if you're 32 now, 10 years ago is when you were 22. So the question is, what are you going to do? I wouldn't want you to run through your whole 30s still being on the same spot. So if we identify you have menopause, what do? We go for donor X. Because what happens when you have menopause? You no longer have X. So you can no longer use any X. You can't use what you don't have. Unfortunately, that's what happens. So any woman that has gone into menopause, but you still want to become pregnant, you need donor X without waste of time. Okay, can a woman with high BMI get pregnant naturally or with IVF? Normally, whether you have age on your side or not, we don't encourage any woman to have high BMI. High BMI is a risk factor to even achieving pregnancy, to even having good outcome. So high BMI means above 25.5. The normal BMI is 18.5 to 25.5. That's where we want it to be. But some women are in their 30s. Once you get to 30, you are in the obesity range. We don't want you to be there. There are so many things that can go wrong when your body weight and your BMI is high. You don't want them to be high. There are some women that can become pregnant in May simply by watching their body weight, simply by losing all the body weight they don't need, simply by doing that. Eating good food, exercising, dropping your body weight, then your hormones will bounce back. There are some women that are having hormone imbalance simply because of the body weight they are attracting and it's messing up with their hormones. So it's not encouraged at all. If you check your BMI today and your BMI is above 25.5 as a woman and you've been having problems wanting to become pregnant, then please, you need to go back to the drawing board. Okay? All right, guys, I've actually exceeded my time. And I appreciate you coming this evening to attend my clinic. Now, something amazing is happening tomorrow. Our community health clinic tomorrow is going to focus on kidneys. There are so many people that have kidney problems, kidney failures. So many families are going through the heartache of going through dialysis, looking for kidney transplant and all that. There are things we can do to stop development of kidney problems. There are things we can do to avoid kidney failure. There are things we can do to avoid the complications that can come from this. So please join us tomorrow, our community health clinic, by 12 p.m., my lunchtime, Eastern Time, US, 5 p.m. Nigerian. We'll spend the 30 minutes and we'll have fun and you'll learn better. I'm going to make it very direct and very simple. So don't miss the clinic tomorrow. It's possible it's your brother. It's possible it's your sister. It's possible it's your mom, it's your auntie that has had kidney problems. And unfortunately, my people, unfortunately, once you get to that point of dialysis, once you get to the point of looking for someone to give you any organ, if you don't have good facilities and if you don't have a lot of resources, unfortunately, it doesn't end well. Okay? So thank you so much. And if you can, join me tomorrow. Okay, what causes a woman to have the signs of pregnancy with missed period only to get a negative result? Unfortunately, my sister, you are not pregnant. If you're pregnant, it will show. If you're pregnant, your test will be positive. Your blood will be positive. Your urine will be positive. We'll see the evidence of the baby. So there are a couple of things that might be happening. It might be you. It might be your partner. Okay? So you need to see a fertility specialist. I can't say, oh, this is this because I don't have your history. So you need to go for comprehensive fertility assessment. Very important. But please, listen to me carefully. Don't waste your time thinking you are pregnant when you're not pregnant. Don't even waste time. Now, you can spend that day you were thinking, oh, your missed period is pregnancy. Then you checked and it's negative. It can be crushing. You can be in a bad place. You might even want to cry. You can cry that day. Let me give you an example. You checked today. You've not seen your period for the past 7 days. And you were so excited because the normal time, the recommended time to check for pregnancy is 7 days after your missed period. Don't go start checking your pregnancy status once one day has passed. You begin to buy all the strips. You're causing yourself anxiety. But at the point on the 8th day, no pregnancy, you can cry. You can just talk anyhow and talk to God. Once it's the 9th day, pick yourself up. Start your 48-hour lovemaking. You will get pregnant. You don't gain anything. Let me give you an example. You don't gain anything getting a negative result in January. Then you use the whole of February to recover. Then by the time you're getting ready in March, you are now in April. Then you have another negative result because you are not practicing the PPP anyway. If you're not in a good place, lovemaking will not be on your list. You may be looking for one church to the other to go for miracles overnight. It doesn't happen like that, my people. Your time will come. So you can use few days. You can feel bad. Once it's the 9th day, get up and keep on going. So pregnancy is not a feeling. Pregnancy is yes or no. You are pregnant, you are pregnant. You are not pregnant, you are not pregnant. If you are not pregnant, it's okay. You will become pregnant in the future. But if you're pregnant, please be careful. When you get your urine pregnancy test positive, it hasn't ended. You need to book an appointment and go for your blood test. When you get your blood test positive, it has not ended. You need to go for ultrasound. When you get your ultrasound, maybe somehow you can rejoice. Then what do you do next? You go for your early ANC. Pregnancy is a long journey, 42 weeks, equivalent of 9 months. You need to be careful. You need to have a specialist that will attend to you. Okay? All right. Okay. There is nothing like low hormonal imbalance, my dear. Okay? Normally, your hormones are supposed to be within a normal range. So women will have high or low. Let me give you an example of hormonal imbalance. Your prolactin is very high. You are not married. You are not having a baby. You are not breastfeeding. Then breast milk is coming out from your breast. When we check your blood for prolactin and we discover it's high, that condition is called hyperprolactinemia, which is a cause of infertility. Thankfully, we have a drug we can give you. Some women might have low progesterone. When your progesterone level is low, it cannot support implantation. You will not become pregnant. Some women might have high FSH, follicular stimulating hormone. You're not supposed to have high FSH. High FSH is indicative that your fertility is dwindling. Some women might have low AMH, anti-Mullerian hormone, which is a test we use in checking the ovarian reserve. So any of these hormones which go outside the range will not enable you to become pregnant. This is simply what hormone imbalance is all about. Okay? All right. Thank you so much. I appreciate you guys. Make sure you join me tomorrow for the kidney talk. Don't miss it for anything. Okay? I'll see you guys tomorrow. Until I see you, I have maybe 2 more minutes. Do you guys still have any questions? Let's wrap it up to 40 minutes. I still have 2 minutes to get to 40. So I'm just going to throw in 2 more minutes. So if you still have any questions, feel free to ask. I'll give you a feedback, then we go. If you still have questions, use this opportunity. I'll give you a feedback, then you go. I have 2 more minutes. 2 more minutes. 2 more minutes. Okay? 2 more minutes. Any questions? Okay. Thank you for coming. Enjoy the rest of your evening. And the next clinic will be on Saturday. My Saturday clinic comes a little bit early, by 12 p.m. Eastern Time, US, 5 p.m. Nigerian time. So it's a little bit early. So check in with me on Saturday. But before then, I will be live tomorrow. It's going to be in Facebook. Then on Friday, I will come back. It's still going to be in Facebook, my 4 days Fridays. Then I come back on Saturday. Then I come back on Sunday. Okay? There is no dull moment in our group. But thank you so much. Levothyroxine is a thyroid hormone. Okay? It's a thyroid hormone we give women that have thyroid disorder. Your thyroid hormone can also lead to infertility. If your thyroid is overfunctioning, which is called hyperthyroidism, or if your thyroid is underfunctioning, which we call hypothyroidism, they can affect the totality of your reproduction and you might have a problem. So when we're giving you levothyroxine, it's to correct the thyroid problems you have. Okay? All right. Thank you for now. have to go this time. Until I see you, God bless you and bye-bye.